Dear viewers, I hope you are all fine. This ultrasound video shows multiple findings. Most important finding is the uterine polyps. Then there is a gallbladder stone, renal stones and ureteral stones. You can see the liver, gallbladder, and a small stone is seen in the neck of the gallbladder. Overgrowth of cells in the lining of the uterus endometrium leads to the formation of uterine polyps, also known as endometrial polyps. You can see the stone in the neck of the gallbladder. Endometrial polyps are benign nodular protrusions of the endometrial surface and one of the entities included in the differential of endometrial thickening. Endometrial polyps can either be sessile or pedunculated. They can often be suggested on ultrasound or MRI studies but may require sonohysterography or direct visualization for confirmation. Classically, endometrial hyperplasia affects the entire endometrium and results in widening of the endometrium. So now you can see the right kidney and it shows two stones. This view is showing a single stone in the but as we continue scanning you can see there are two stones lying upside down. Uterine polyps are more likely to develop in women who are between 40 and 50 years old than in younger women. Uterine polyps can occur after menopause but rarely occur in women under 20 years old. Now you can see the right kidney and both the stones. The prevalence of endometrial polyps increases with age and range from 7.8 to 34.9%. Endometrial polyps are frequently seen in patients receiving tamoxifen. Other risk factors include foreign bodies, multiparity, chronic cervicitis, and estrogen secretions. Around 5% of uterine polyps are cancerous or precancerous. Now you are going to see the left kidney and it shows mild hydronephrosis with minimum hydroureter and a stone is seen in the proximal portion of the ureter in the lower one third of the ureter close to the ureterovesical junction. You can see the ureter. Now, most polyps are asymptomatic, although they can be common cause of postmenopausal bleeding. In premenopausal women, they may cause intermenstrual bleeding, metorrhagia, and infertility. Uterine polyps range in size from a few millimeters, no longer than sesame seed, to several centimeters, golf ball size or larger. You can see a tiny stone seen in the distal portion of the ureter. close to the ureterovesical junction. Uterine polyps attach to the uterine wall by a large base or thin stalk. You can have one or many uterine polyps. The main difference between fibroids and polyps is the tissue they are made of. As mentioned earlier, fibroids are made up of connective fibrous tissue, whereas polyps are made up of same tissue that makes the uterine lining, also known as endometrial tissue. Now you can see a tiny stone. As the stone is very small, so the ureter is not much dilated and focusing of the stone is difficult. Now you will see the uterus and the uterine polyp. Now you can see a uterus seen in the distal portion of the uterine cavity. Signs and symptoms of uterine polyps include irregular menstrual bleeding, for example, having frequent unpredictable periods of variable length and heaviness, bleeding between menstrual periods, excessively heavy menstrual bleedings, vaginal bleeding after menopause, infertility. You can see is polyp. This is the polyp in the distal portion of the uterine cavity. And this polyp measures about 16.7 millimeter into 12.6 millimeter. Now the causes of uterine polyps: each month estrogen levels in women rise and fall, causing the lining of the uterus to thicken and then shed during the periods. Polyps form when too much of that lining grows. That may be due to the changes in the estrogen levels and happen just before and during menopause. Treatment may not be necessary if the polyps do not cause any symptoms. However, polyps should be treated if they cause heavy bleeding during menstrual periods or if they are suspected to be precancerous or cancerous. If a polyp is discovered after menopause, it should be removed. Thanks for watching. Please subscribe my channel. If you do like this video, please click the like button. Thanks.